Bismillahir Rahmanir Rahim. Assalamu alaikum. My name is Abdullah Rana. I'm a colorectal and general surgeon here in Adelaide. I would like to talk to you about surgical procedures during the month of Ramadan. It is a blessing upon us that the month of Ramadan is again graced us with its presence. While in Australia life goes on during the month of Ramadan, if you are scheduled for surgery, you might want to have and might have to proceed with it. We can divide the surgical procedures into minor and major, and day surgery and overnight stay procedures. The minor procedures, which would require local anesthetic, might be able to proceed, in which you do not require to fast and all you require is local anesthetic, and you do not need, there is not anticipated blood loss. Major procedures that require fasting pre and post and have the risk of having major blood loss, it's advisable not to fast. You can discuss it with your healthcare professional, the healthcare service, your GP or your surgeon. If the procedure, which is non-essential or non-urgent, could be postponed after the holy month, or if it needs to proceed because of its urgency or because of the scheduling, it needs to proceed, then it's advisable that you do not fast the day prior. The fasting guidelines should be adhered to get the best results, and the Ramadan or the Roza could be done later. You can compensate for that later. In terms of fasting guidelines, you should at least have 6 hours of fast before requiring a general anesthetic. You can drink water up till 2 hours prior. So if it adheres with the guidelines that you can fast or have the procedure later in the day, then it's okay to proceed, as you would be able to eat after the procedure. Amongst the essential procedures, I would give you some examples. If there are certain life-saving procedures like cardiac procedures, if there are some cancer surgeries that need to be scheduled during this month, then please proceed with them and adhere to the guidelines given by the healthcare professional or the healthcare service, as those procedures have to proceed according to the guidelines, according to their urgency, and the fasting can be compensated for after the month of Ramadan, as we have been given this opportunity by Allah Almighty that you can compensate for the fasting afterwards. So please adhere to the guidelines given by the healthcare professional and the healthcare service, and do not cancel your essential procedures. Jazakallah khair.